Okay.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
And today, Brad, our subscribers are in luck.
Yep.
Because we're going to show you the absolute best treatment, as Brad put it, the emphatically the best treatment for Morton's neuroma. And the reason we know that is because Brad has Morton's neuroma.
You bet. And I've worked with patients, and when this treatment, which is very nice and right at home, works, your pain can be at an 8/10, high pain, you put it in, and it turns it off.
Excellent.
Experience to myself, I have patients that do it. It doesn't mean it works all the time, but when it works, and it's really, the good thing about it is it's cheap.
So very quickly, Morton's neuroma is an inflamed nerve that it happens in your foot, generally happens between, can we show it on the skeleton?
Oh, that's a good idea.
But I'll show the picture while you get that ready. It's an inflamed nerve that happens between the, how am I doing? Down, right there, between the second and third metatarsal or the third and fourth metatarsal. There's the inflamed nerve. Now Brad's going to show you on the foot.
Okay, so we're looking at the bottom of the foot here.
Here's the big toe.
Okay, here's the heel, of course, and it's going to be right here. Can you see that, Lonnie?
That's between the third and fourth.
Yeah, it could be there or it could be
there.
here. You'll know where it is because when you push on it, it's going to hurt. It's going to make you say bad things.
And people, when I read Brad, it sounds like, it feels like there's a pebble in your shoe, right?
Yeah.
Or worse.
Right. It's going to make you limp if it gets bad.
Okay. This is the #1 treatment that we suggest. All right, Brad, take it away, baby.
Okay. So what we need to do, essentially, let's get down on my foot here. Mine is right there. Okay, when it hurts, if I push on that, it hurts a lot, so I don't do that, of course, when it's flared up. But what we need to do is take the pressure off that. When you walk on your shoes and pressure goes through your foot on there, it hurts because you're irritating the inflamed tissues. We need to spread the force out to the healthy tissues around it. And you'll find that if you put it, you can't go up here because you've got bones from your tarsals and metatarsals where the joints are. If you go right below it, it kind of in the arch of your foot, right around in here, and it's kind of specific. You just have to get some cushion in there, take the pressure off the neuroma, and get it onto the healthy tissue. And when you do it and you get it in the right spot, it makes you smile when you walk. And it's really fun as a therapist when the person walks out and they're just loving you because they're feeling so much better. Now,
So the pad's going to go right in the arch of the foot.
Right.
Okay.
And you can buy pads made for this. You could go online, look up Morton's Neuroma pad.
Yeah.
If you go to a lot of shoe stores, may have them. What I did, because I'm kind of a tightwad, and I know that I can make it work without buying something, so I just went home and I got some cushion. You could use felt. I used some squishy insulation from copper pipe, and I cut it up to make it work. This is some pad that wasn't the right size. It's for cushion in the foot, but it wasn't the right shape. So I just took some scissors. I cut it about the size of a quarter or a silver dollar.
That'd be more of a dollar. I think.
Yeah, whatever. About that big, you know,
Silver
make a
dollar,
hole with
yeah.
your finger like that. And then I'm going to cut a second one because you don't want to just put a flat piece in. You want a little bit of a bump. And I'm going to take this, and this happens to have some sticky stuff on here. And I'm going to put that in the middle there. And there's no definite rules about
So
this.
this is the part that's going to pressure up against your foot, right? Not this part. This
Right,
is the part that's
right. Well,
against the skin.
You're going to see, what I like to do is, you can't put it in your shoe and slip your foot in there, otherwise it pushes it out in the wrong spot. So take your insert out, put it, and you're going to have to guess where it goes so it lines up to the
Oh,
right
it's
spot.
underneath the insert.
Underneath the insert.
Oh, okay.
And then what I always do is I just take some tape, duct tape. I like duct tape, but you can use any kind of tape. And you're going to rip it like so. And this is getting right down to some handyman stuff. And you got to just put a little sliver of tape on there just to hold it. Okay? And then you slip it in your shoe, get the insert where it belongs, and it will stay there. And now you can't see the pad, and you can slip your foot in and it will not move because it's stuck with the tape, and it will be there as long as you need it there. And I can feel right now I need to move it back. It's
Okay.
not in the right spot, because when it's in the right spot, it'll feel real good. And I can feel the bump is more under my toes than that. So simply you have to take it out And
It may need some adjusting, in other words.
you may have to do this a few times.
Sure.
I've done it like 3 or 4 times before you get it right, and you'll know, because it's starting to get right, that's feeling good, and you'll think, God, if it's just back a little bit more, so then you go ahead and do that, and you just move it, keep the tape there. I'm gonna move this back a little bit like that.
Brad, would you say when you have Morton's Neuroma, could you put that pad in there, and would you be able to run then, or would that be just too much?
No, I think you could. If it's
You
not
could
too
walk.
bad,
You
yeah.
definitely could walk.
Oh, yeah, it makes a big difference.
Okay.
I get mine when I ride my bicycle. I've got shoes and I clip into the pedals, and if I'm riding a long ride, it hurts so ungodly bad that it's pain. It's just no
Okay.
fun to ride anymore.
And that will take it away.
Yeah, and I work with this. That's a little bit different because it's in the bike shoe. But yeah, I work with my inserts and get the pressure off because
Okay.
you're not stepping on it like you're on a shoe. But when it works great, and I've experienced myself, had patients experience it.
Can we name just a few other things, Brad, that people might do for this?
Sure.
I mean, do you wanna name some? Well, ice.
Oh, I
right?
see, yeah, the treatment, yeah.
Some people even massage around the nerve, but like you said, you definitely can't put your fingers on that nerve, that'll just fire
If
it
it's
up.
flared up,
Yeah.
you gotta go around it.
Rest,
Yeah,
avoid wearing tight pointed shoes, you wanna really have a big toe box. You wanna avoid wearing high heels like you normally do, Brad, right? Because when you wear those high heels, it puts a lot of pressure on that nerve.
and the other thing I just noticed too is that if you have shoes that the toe box is concave, or it actually goes
Oh,
down because
sure.
they're not built very well, that kind of squishes all that tissue together and irritates it
Makes
as
sense.
well. So you might just need a new pair of shoes or a different style.
You certainly can take an anti-inflammatory,
Yeah.
ibuprofen or something along that.
Sure.
You said you've done that, Brad?
Yeah, when it's in an acute phase, I'll do that.
But people have had luck with corticosteroid injections. I think they also do some other injections in there, which is
Yeah.
beyond our scope.
Yep, that's to the doctor.
And I have seen it where they have done surgery even.
Sure.
So
Yep,
those are the things you can try, but absolutely the first thing you want to try is the Morton's pad,
yep.
Morton's Neuroma pad. Make your own or buy one on Amazon or wherever you want to go. We don't care. And if you haven't already, please subscribe to us. We're going to help you, give you videos on how to stay healthy and fit and pain-free.
All right,
Thumbs up, Brad.
you bet.